Diagnosis always start with that thing, TSH, blood work. So what's going to happen in hyperthyroidism? Your TSH is going to be low. Okay, that's how we diagnose it. So treatment. There are medications specifically to treat for that high thyroid hormones, okay, like methimazole and PTU. Sometimes you can give some radioiodine through the mouth to give a little bit of damage to your thyroid gland so that your hormones production slows down. And surgery is sometimes, can be performed to take part of your glands out so that your hormone production slows down. Also, when you're having tremors, anxiety, your heart rate goes up, we tend to use medications like atenolol to slow down those symptoms, okay? So that's basically the overview of hyperthyroidism, okay? Next on the list is thyroid tumors. I myself have never seen one patient yet, so they're not very common cancers in your body, okay? But since we're talking about thyroid problems, I might as well talk to you about those. If you find a lump in your gland, okay, most commonly that can be a benign nodules, meaning that it's not cancerous, it's just staying there. Like I said, we will try to do ultrasound first, and then if we needed to, we'll refer you for the thyroid biopsy, like a needle biopsy of the gland, okay? That's how we diagnose whether it's a cancer or whether it's a benign lesions. Speaking of cancer, there are 4 types of cancer. You don't have to remember those names, but they are, can be common, especially like in younger age group. The first one is very common. The rest, some of them can be presented when you get older. Usually the causes of the thyroid cancer are the radiation of your head and neck. Like you treat one cancer on your head and neck region with the radiation, that can increase the risk of thyroid cancer. Okay? Fortunately, regular X-ray like chest X-ray, those kind of things would not increase the chance of thyroid cancer. Okay? But you have to have a high radiation dose in order to cause thyroid cancer. Sometimes inflammation of your thyroid gland, like thyroiditis, can turn into thyroid cancer as well. So like I mentioned before, usually biopsy is the key. You have to look under the microscope to see what type of thyroid cancers and stuff like that. Okay. Treatment, as with all the cancers, it's either surgery, radiation, or chemotherapy. And, I usually leave it up to the experts to do this. Okay. All right. We're on the last page. We're doing good. Okay. Anybody needs a bathroom break or anything? We'll be done in about 5 minutes. Okay. All right. The next thing I like to talk to you about is called goiter. Goiter is a term, okay, simply meaning enlargement of your thyroid gland. All right. That may or may not cause any abnormality in your thyroid hormone production. So basically, goiter meaning your thyroid gland is enlarged. Most commonly caused by iodine deficiency, usually in other parts of the world, developing countries where iodine is not standardized in the food supplies. You can have enlargement of your thyroid glands. Okay. And like I mentioned, usually your thyroid hormone production is not affected. But sometimes, if you have long-standing enlargement of your thyroid gland for years, sometimes your gland started producing more hormones, and maybe sometimes you can see features of hyperthyroidism. Okay. Usually, goiter, if it's not too large, we don't have to do anything. Of course, a cosmetic, problem. Your neck doesn't look the same as other people, so sometimes it's a cosmetic reason you can remove the gland. But sometimes, if it's get too large, you can press on other structures in your neck and cause obstructive problems. You can do surgery at those times. Okay. And I'd like to briefly mention to you about goitrogens, the substances that cause goiter, that can enlarge your thyroid glands. Iodine, especially in kids, cough medicines can have iodines in there. If they take a lot of those, it can cause enlargement of your thyroid gland. Lithium, the medicine that I mentioned earlier, can cause enlargement. Cabbage and cassava, believe it or not, I don't know how much you have to eat to enlarge your thyroid gland, but it's been known to cause goiter. Okay? All right. So don't eat a lot of cabbage. Okay. So going to the last. It's rare problem, but I like to mention to you just to complete our talk here. Okay? It's called thyroglossal duct or cyst. You can see the diagram. It starts with your nose. You can see your mouth, and then you can see the tongue. Thyroid glands, when you're in your mother's uterus, it started developing, and it goes down from your tongue area towards your neck. And you can see the dashed line through there is the part of your thyroid glands, from your base of your tongue to your neck. Sometimes that duct persists, and you can form little cysts. You can see there are two round things along that line. Those cysts can be found in some of the people, okay? And it's called thyroglossal cyst. If you protrude your tongue, it goes up. So that's one of the rare conditions. Okay? Just like to throw in there. All right, that completes our talk. Any question for me?